Hi, I'm Lorraine, the Care Home Manager from Princess Court Lifecare in Ashburton. To get an assessment completed through the needs assessment team, either based at the hospital or anywhere in the town where that contract is kept, it has to go through your GP. So first and foremost, the first place you would go would be to your GP. At the GP, they would perhaps complete a memory test. They may send you off for a CT of your head. They're two things, and also a full range of bloods. So they'd be checking thyroid levels and B12 levels and things that, if they're out of kilter, can actually affect your memory. So it's really important to make sure there's nothing medical going on for you before they start making any kind of diagnosis around, any types of dementias. You may, depending on if there's management issues or medication challenges, be referred to a psychogeriatrician. But the psychogeriatrician doesn't see everybody who has dementia. It's not a requirement. They usually will see somebody for the GP if the GP is struggling around medications and the management of your dementia. So the GP may refer you to the needs assessment team at the hospital. That one of those ladies would come out, they would complete an assessment in your home, they would look at where the challenges were, what supports could be put in place at home to support both the person with dementia and the people that are looking after them. And then from there, that also, if you've had an assessment and you have a diagnosis of dementia, you can be referred to, in Christchurch, for instance, Dementia Canterbury. So that's an organisation that supports the people with dementia, but also the carers, and for the most part, actually the carers. So Dementia Canterbury, for instance, runs a lot of education groups for carers. They have coffee mornings for the people with dementia and their family to come along. They run memory group days. So there's a lot of education and a lot of support there, but you can't access Dementia Canterbury without a diagnosis. So some people are a little bit wary and they don't necessarily want the diagnosis. They think that, to put a label on it, do we have to have that? But it is very important for a lot of those services that you have got that diagnosis. A part of the needs assessment process that I just spoke about is also that if you have been assessed, you are generally entitled to some respite. So that 28 days a year is allocated for someone to be able to go into a care facility and be looked after so that the carer can have a break and recharge their batteries. And that is often used because a lot of people want to keep their loved ones at home as long as they can, and that's the way it should be. But in order for that to happen, the carer themselves has to remember to look after themselves. And often a lot of people won't ask for that help because they think they should be able to do it. They made wedding vows 55 years ago that said, until death do us part, and I'll never put you into care. That was then, when you were both young, standing at the aisle and everything was good. Putting somebody into respite is not meaning you're not looking after them. What you're doing is inadvertently looking after them really well while looking after yourself. And what we find is a lot of people, they just hit the wall. And then suddenly it all has to happen and it's all a big emergency, when if it's just planned and every now and again you have a few days break, you can, as I said, recharge those batteries and carry on.